Hi, I'm Dr. John Puma, and welcome to the ChefMD Video Blog. This week's question comes from Ella in Tampa, Florida. Ella writes, I'm a stage 3 breast cancer patient in radiation treatment, looking for some new ideas to fix for myself and better half. I have the book, Eating Your Way Through Cancer, but I'm looking for something different to try. Ella, thanks for writing. As you know, there are very few really good data about how to use food to treat ongoing breast cancer. But there is some new data, and it's simply that something that was been thought to be true for a long time doesn't seem to be true. Low-fat diets don't seem to prevent breast cancer or breast cancer recurrence, but low-saturated fat diets, solid fat diets, the fat that's found in cheese and in chicken and in beef and in coconut and in other dairy products, does seem to, along with diets that are low in alcohol or have no alcohol. Maybe the most important thing is to lose any extra body weight. That's easy to say. It's hard to do. You do it one step at a time, doing something right one day, recognizing yourself for it, giving yourself a pat on the back, and doing that same thing right the next day, and then adding one once you feel really good at that one thing. Finally, there are two foods that are kind of on the horizon that seem to be good in breast cancer recurrence. This is something you might try in reducing breast cancer recurrence. Increase foods that have lignans, which is a phytoestrogen, which lentils, these beautiful, easy to cook, don't need pre-soaking, high protein, wonderful flavor. You can make a wonderful dal, an East Indian dal from them, and then make a soup of it or a burger. There's a recipe on my website you might want to try. So use more lentils and consider drinking more tea, especially green tea, which has antioxidants called catechins in it that may be helpful. In young women, those who are premenopausal, high intake of red meat and high-fat dairy products may actually increase premenopausal breast cancer. I realize that's not the case directly for you, but there are other women who may be listening to this that I want to talk with as well. So that's a way to help to try to protect young women at risk for breast cancer. Try that burger wrap, the lentil burger wrap I mentioned, or a curried lentil soup, also on my website, chefmd.com. From start to finish in 30 minutes, it doubles easily, it's inexpensive, it has more protein than any other legume a lentil does, except for a soybean, and it's very low in saturated fat. The dish is beautiful and filling. Make it, and if you like it, teach it to someone else, and leave me a comment about how you did it on chefmd.com. Thanks for writing, Ella. I'm Dr. John Puma for ChefMD.